Hero Wars. Take a break and dominate.
Available on PC and mobile.
Hero Wars. Take a break and dominate.
Available on PC and mobile.
Good evening, everyone. Can you hear me? Good evening, everyone. Thank you for joining me again this evening. Hope you can hear me. We have how many? Yes, finally. Hi, Kat. I remember Kat. Did you join us last time, Kat? I remember Kat. Good evening. We have. Let's wait for a couple more minutes and then we'll make a start. Yeah. So, good evening. Thank you for joining me for another Study With Me session. And hopefully you will join. Hopefully you will learn something new tonight. Just to check you can really hear me, yeah? Can you please type on the chat box where you're from, which part of the world or which part of the UK? Hi, Grace. Is this the Grace? I know. Okay, so guys, just to make sure that you can hear me, yeah. So if you can put type on the chat box where you're from. There you go. Let's see which part of the world you're joining us from tonight. I can see, Kat, you're from Ipswich. I've been to Ipswich before. Do you know, I'll just give you a story. I've been to Ipswich because I've attended Ed Sheeran's concert before. Ipswich is Ed Sheeran's home. Am I correct, Kat? So, yeah, if you want to find Ed Sheeran, that's her place. Um, PC is from Romford. Thank you. Let's wait for a couple of more people. We we have, and then we'll make a start. So for those people who's watching this video later in the evening or in the coming days, thank you for watching and thank you for subscribing to my channel. If you're new to my channel, hello, my name is Emer. Please do subscribe because based on 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 my YouTube channel, they said, I mean, it said that 60% or 70% are not subscribed. Okay, so please do subscribe. Someone from Stroke on Kent. I think I've been there. I just can't remember. How do you say your name? Jo Kwezoho. That's a very nice name. Yep, so yeah, if you're new to my please do click the notification bell because it will alert you if there are anything happening or like new videos or any announcement, especially if we'll be doing like another live stream. So Wednesday we do live stream every 8 o'clock. Yeah. So let's do another one next week. Um, what else? On the screen, as you can see, there we have the final coaching this weekend. Yeah. So hopefully you can join. You will see. Click the registration, the link there on the chat box. Okay. All right. So let's make a start. Okay. So for those people who will be joining us later, thank you for watching. Can you not appreciate my background? Yeah. So my camera is better now compared last time. I think I need to adjust the settings. Okay, so I did ask you guys, what do you want to learn tonight? Okay, so based on the poll, I cannot see it. Based on the poll, it says here implementation station. Uh, there are how many people? There are 37% who voted to discuss implementation station. So next time for next week, I will ask you again. We'll do another poll, and then you tell me what do you want to discuss next. A lot of people actually answered others, but they did not comment what others they want to discuss. So please, if you want to put in the chat box what topic or what session you want to see next time. Okay, so when we do voting, because people just click others, but I don't know what others means. Okay, so please put it on the chat box. All right, so assessment was third, and then no one voted for planning. I think all of you are pros in terms of planning. Yeah, but if you want to discuss a particular scenario, a particular care plan, why not? We will discuss. Okay, so when we do live sessions, I don't have a presentation. We will just chat, of course. Because I want to hear the answers from you guys. We will share some answers. I don't have the right answers most of the time, but if I don't know the answer, but we will have a look together. We will discuss. Yeah. So for those people, just join us. If you can put on the chat box where you're from, so we know. All right. So tonight we'll be discussing the implementation station. So we will discuss the marking criteria. Okay. So hopefully I will hear your thoughts about the marking criteria. So if you started your OSCE journey or your review in terms of OSCE, So definitely go back to to the previous live stream, and go back to the previous live stream, and what you call this, make sure to access the test center's website, because all the resources for the examination will be there. Okay. All right, let me show you the marking criteria so we can have a look. Let me just find it. Okay, and then let's put your chat on the screen so you can see. I think you will be able to watch the comments once the video finishes. You can still watch it. Okay. I'm trying to find where the marking criteria is. All right, there you go. Voila. All right, so on the screen, you can see the marking criteria. Are we familiar with the marking criteria? Let me just drink my coffee. Have you all seen this marking criteria? So, I'll be showing you which marking criteria? I will be showing you marking criteria version. It's version 2.1. Okay, so this is the first. This is the version we're going to discuss. So, like but I mentioned on previous classes, to make sure before you do your OSCE, you access the most recent marking criteria, because they do change it every now and then. They change it regularly, not regularly, like every 3 months or 4 months, depending on if there's like a need to revise the criteria. So far, ever since I think for implementation station, let's go to page. What page is this? Page number 10. So if you have a copy of your marking criteria, but you can see it on the screen as well. I will show it on the screen. There you go. All right, so this is the implementation marking criteria. Let's have a look. All right, so during the exam, this will be the criteria you will be marked against. So just remember, guys, all the test centers will be using the same marking criteria. Okay, so if you're taking examination, let me know in the comment section where you're taking your examination. Raise your hand. Who's taking the exams in Oxford Brooks? Who's taking the examination in Ulster? Who's taking their examination in Northumbria, in Leeds, or in Northampton? Okay, so if you can put your comments, so we know where you're taking your examination. Yeah, put it on the comment section. So we will test centers will be using the same marking criteria. Ulster, PC. So you need to fly. You need to fly to where do you need to fly? You need to fly to Northern Ireland. Okay, so there you go. Well done. So who else? Let's see. Some people. Sakura. I remember Sakura. Sakura, were you here last week? Yeah. So Sakura, she's taking it from Oxford University. When I did my OSCE, I also took my exam at Oxford Brooks University at Oxford campus. Kat said she's doing it at Northumbria this Friday. Oh my God! Let's say good luck to Kat. Yeah. So Kat, we will be praying for your exam this Friday, and of course for all those people who will be taking their exams very soon. So good luck, Kat. Just relax. Yeah. I know it's hard. It's easy for me to say relax, but relax. You can do it. Who else? Neelam, I remember Neelam. Neelam was here last week as well. So Ulster University. So you will be flying in um, Northern Ireland. Same with Theodora. Hi Theodora. Anita, Leeds. There you go. Joanna, Leeds as well. Joanna. Joanna. I know Joanna. Joanna, are you the Joanna in one of our classes? See, I still remember names. Anita leads as well. Sakura, yes. I remember Sakura's name. So yeah, if you can sound off below, not below, on the comment section, where will you take the examination? So good luck. All right. So good luck for those people who will be taking the exams very soon. Like Sakura, no, like Kat. Okay. All right. So let's discuss the marking criteria now. So again, across test centers, across five different test centers, they will be using the same criteria. And this is the recent one. Okay. All right. Have you not noticed? Sorry, I'm just looking at my monitor. Yeah. Have you not noticed my new hairstyle? I had a haircut finally after a couple of years. All right. So let's start discussing the marking criteria. So the first criteria is number one, you have to clean your hands with alcohol hand rub or washes with soap and water and dries with paper towel following the WHO guidelines. So based on the criteria, this is the first step um, according to the marking criteria. So I have a question. Probably most of you learn from your during your training or from your friends or from the video you watch on YouTube that the first step should be identifying if the scene is safe, providing privacy and dignity. What do you think? Should we do that first, or it's not necessary, or what do you think? What do we think? Shall we stick with checking if the scene is safe first, or privacy and dignity? What should be the step? If you can type it on the chat box, so I will know. Just to check, is the background music too loud? Yeah, let's do. Shall we do what do you call this? Scene is safe first. Um, privacy and dignity first. Um, Nurse Marian said the scene is safe. Okay, so let's do that first, according to Marian. So, looking at the marking criteria, it doesn't say it. Okay, it doesn't say that you have to check it. So, if you studied all the marking criteria, all the stations in the OSCE, there are only two stations wherein checking. Not too loud, thank you, PC. So, what they call this? If you check the marking criteria, all the criteria, all the stations, there are only two stations in the OSCE wherein checking the scene, the safety of the scene is essential. Okay, can you guess? PC said on the screen, I think it's not necessary since it's not in the criteria. So, before we answer this, what do you think are the two stations wherein checking the safety of the scene is necessary? Can you guess which are the two stations? IHR, well done, PC, definitely. So when you do your in-hospital resuscitation, it says there, number one, to check if the scene is safe, the environment is safe. Okay, that's number one. Which station is another station? Well done, that's very good. There's another station. Well done, Kat. It's IHR. Definitely, you have to check if the scene is safe before you proceed. There's another station wherein this was actually mentioned. Well done, Sakura. Well done. Okay, so that's the answer. So Sakura and the rest of you said it's IHR and assessment station. Okay, let me just show it on the screen so you can see it. Assessment. Well done, Neelam. Okay, so there you go. Let me just quickly show it on the screen so you can see it. So if you go to assessment station, okay, there you go. Assessment station number 1, assess the safety of the scene and the privacy and dignity of the patient. But for other stations, it was not mentioned. Okay, so Emer, going back to the question, shall we start with the scene is safe? Why not? Okay, why not? So although it's not mentioned in the criteria, why not? But Emer, will I pass without doing it? Of course. Okay, because let's say if you receive a comment saying you did not check the safety of the scene for implementation station, again, we are referring to this marking criteria. Again, if you're watching this in 3001, probably it's already changed. So at this point, at this very moment, based on the current marking criteria, it doesn't say. Yeah, but of course, probably it's better if you start with it. Yeah. So if because I know you've been practicing like relentlessly implementation station and you always start with safe, provide privacy and dignity, why not? Okay, you can still stick with that. Okay, you can still stick with that. That's okay. All right. If you ask me, probably that's the best. But again, will you still pass without doing it? Of course. Okay. So just so you know. All right. So 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 the one on the screens are the important criteria. Okay. Again, the one on the screen are the important things you have to really perform on the day of the exams. So wash your hands, of course, with soap and water and dry ice with paper towel following the WHO guidelines. So during the exam, you will be washing your hands using the alcohol. You will be performing a hand rub. Okay, so you'll be given what do you call this? Like a gel, an alcohol gel, and then you will be performing a hand rub. Okay, so although it says here soap and water, but it's very rare. I mean, it's rare that you have to wash your hands. I think I've heard from some candidates that they were asked to perform hand hygiene. I mean, using soap and water, but it's rare. Okay, it's rare. You will be using a hand rub. Okay, you will be performing hand rub. Okay, and you will be using a hand gel. Okay, I hope that's clear. But of course, you practice. Why not? So, how many steps do we have for hand hygiene? How many steps do we have for hand hygiene? Let's see your answers. How many steps do we have for hand hygiene? Shout out to how many people we have watching. PC said 7. Do we agree with PC? How many steps do we have for hand hygiene? We have 2 million watchers tonight. Okay, so hopefully everyone could comment. Yeah, so Kat said 7 steps. 7. Do we agree um with the three of you? Let's see. All right. Okay, so according to them, 7. Check if it's 7. Okay, so make sure to practice. Yeah, how many steps? So your palm to palm, your back to back, etc. I don't memorize it, but please do practice your hand hygiene. How many moments of hand hygiene do we have? Francisca said 7 as well. So how about how many moments of hand hygiene do we have? So before touching the patient, after touching the patient's surroundings. 5. Thanks, Marian. 5 said love. Also said 5. Thank you. So Pisa said also 5. We have 5 moments of hand hygiene. Theodora said 5 as well. Well done. So we have 5 moments. So make sure to observe 5 moments of hand hygiene during this station. Okay, so definitely it is a must to perform hand hygiene before you, not before you start, before touching the patient, definitely. So at the beginning, and another one definitely at the end. Okay, so 2 already. Okay, and then let's find out later when do you need to perform hand hygiene again. So hope that's clear. So again, we have 5 moments. So it's important for the station, before you touch the patient, you wash your hands. And once you finish, or before you finish the station, before your time ends, make sure to perform another hand hygiene. Okay, all right. So the second criteria is you have to introduce yourself to the person. So you will be telling the person who you are and what's the reason of your visit. Probably you are here to perform, you are here to administer your medication, the patient's medication. And probably you might specify what time of the day. Okay, so I'm here to give your 12 o'clock medication. The time is not important, but it will prompt you to remember what medication, what set of medication you're actually giving. Okay, so on the exams, just remember this. Remember these guys. The story of the exam progresses. So probably during assessment station, you've met the patient in the morning, and now you're performing the lunchtime medication. Again, you might be you probably assessed the patient at 7 o'clock in the morning, and yet now you're performing, or you're about to administer the 12 o'clock medication. Another example is you've met the patient lunchtime, and now you're giving the evening medication. Okay, so there is a scenario on the exam wherein you're giving the evening medication. I think there's 2 or 1. Yeah, there is a scenario. Again, there is a scenario in the examination, definitely, that you have to give the evening medication. So please read the scenario properly. Okay. Next is you have to seek the consent. Again, please do subscribe to my channel, share this live so your friends will see it as well, and click the notification bell. And of course, follow me on my social media. It's here on the screen. Why not? Okay. So you won't miss anything. All right. So number 3, seeks consent from the person or care prior to administering the medication. Let me ask you, what is your famous question here for number 3? What do we normally ask the patient to confirm? If you can type it on the chat box, what is your famous question? Help me. Okay, so what do we normally ask the patient? I know you're still typing, but I'll wait for it. Kat said allergies. Kat, before allergies, what do we normally ask first? To confirm what question do we ask before we proceed? Love said, sorry, I cannot read. You're too far on. Love said, are you happy for me? Did you say? I cannot read it. Hang on. Are you happy for me to? Sorry, my screen is cut. Are you happy for me to do it? Okay, why not? Okay, any other suggestions? Are you able to swallow? Identify the birthday. So, definitely for number 3, we need to check for the consent first. Okay, so I understand some of you are advanced. you know this already, but probably some of the people who's watching now, it's their first time learning about implementation station. So number 3, of course, we need to ask, are you happy for me to proceed, or are you happy for me to administer your medication? Definitely number 3. I'm just referring to number 3. Yeah, so number 3 definitely is you have to seek for the consent. Okay, so that's your question. Okay, are you happy for me to proceed? There you go. Or are you happy? At least we consider the patient's happiness. Definitely, we need to consider that. Is that okay with you, PC? Well done. That's a good question. All right. So that is your question. Okay. Of course, you cannot continue with your um with your station if the patient said no. Okay. But my question is, what if the patient said no? What will happen? Neelam, well done. Neelam said, "Are you happy for me to proceed?" Well done. Okay. So, question: you'll never know. In real life, this happens. What if the patient tells you, "No, Emer, I don't want you. I'm not happy for you to proceed." So, if this happens on the day of the exam, what will you do? Okay. You'll never know. Okay. We're trying to simulate the possibilities during the exam. So again, what if your patient said, Emer, I'm not happy for you to proceed. I don't want to take my medications. that's that's a good answer, PC. I don't know if PC is a he or a she. Sorry, I don't know your pronoun. I'm really sorry if I say it wrongly. So PC said, then you will not do any implementation. Definitely, you will not be able to perform implementation. That's very good. Okay, of course, you will not be able to proceed. But let's try and relate it in real life. um, so Sakura said, ask the reason, okay, why she doesn't want it. Okay, so that's good. That's good thinking. Kat said, could refuse. Why not? So if the patient tells you, I don't want it, refuse, and then you tell the assessor, that's the end of my station. Is that correct? Marian said, ask the patient, may I know why you don't want to proceed? Okay. May I know the reason? Surya said, may I know the reason? Well, there you go. Well done. Okay, so you might need to ask the patient the reason why they don't want to take medications. Okay, so probably, of course, in real life, okay, do not just give up. Yeah, do not just give up. If the patient said no, okay, I give up. All right. Well done. Yeah. So probably, of course, well done. Thank you for your answers. Respect and document. CC said respect and document. Okay, all right. Let's see. Let me just have some comment. Love said inform the possible consequences, the effects, if the patient is not able to have the medication, and ask the reason why they don't want to take it. If they still say they don't want to take it, then we have to inform the prescriber and of course document. There you go. Well done. That's very good. Of course, definitely, if the patient doesn't want it, of course, try to explain. Of course, ask the patient what's the reason behind it. Of course, and of course, try to explain what's the importance of them receiving their due medication. Of course, like what Love said, we might need to, of course, tell the patient what might be the consequences of them not taking the medication, the importance of the medication, the benefit of the medication. And of course, once everything failed, definitely you have to escalate. You need to inform the prescriber. Probably they could think of an alternative because let's say, what if the patient doesn't want it because they feel nauseated, okay? They feel sick. What if the patient doesn't want it because they're having some problems swallowing, okay? They might have dysphagia. That might be the reason. And of course, there are other multiple reasons. Okay, it might be a reason of it might be because of poor medication compliance. Okay, or they don't understand what is the task for or what's the importance of the medication. So hopefully that is useful. Of course, this will be applicable in real life too. Let's read some more comments. Angelica said, "I will ask the patient the reason behind, and of course, behind the refusal." So well done, very well done, guys. So see, you're still awake this evening. Um, Going back in terms of examination, definitely the patient will just say yes, of course. Because going back, I can't remember who said it, but of course, if the patient said no, then how will you be able to continue with implementation station? So most likely on the examination, the patient will tell you, of course, I'm happy to proceed. You carry on. Okay, so that's the examination, of course. In real life, it's not just, some patient it will be easy, but definitely not for everybody. All right, so that's again number 3. It's important, going back to the marking criteria, it is important to ask for the consent for any procedures. Again, this does not apply in implementation station. Of course, it's also applicable for any other procedures or any other stations in the OSCE. Of course, except for writing stations, because of course you don't need to talk. But just remember, of course, in writing station, you need to write, ask for consent. Remember, for your professional values and your evidence-based consent. In there you go. If you know it, we will have another session about that in the coming days if you request. All right, let's carry on. Number 4, checks allergies and on chart and confirms the person in their care, and also notes red ID, wristband where appropriate. So I think I've seen your answers earlier. You said it is important to check the patient's identity. Okay, can you please help me? What are the essential information we have to check before administering the patient? Not the patient, the medication. Can you please comment? What are the essential information we have to know or we have to check before giving the medication? If you can type it on the chat box. What are the essential information we have to check before proceeding? While waiting for your answer, I'm just listening to the music, yeah? All right, I can see answers now. Let's see. Okay, let's see. Sorry, I cannot read it. Okay, PC said the name, the date of birth, hospital number, and allergies. Well done, definitely. Robin said allergy. Love said the name, so we're referring to the patient's full name, the date of birth, hospital number, or the address if in the community, and allergy according to Love. Well done. Robin said ID check and allergy check. Peter said prescription is legible, sign, and valid. Of course, we will talk about the prescription later. PC. Nilam need to follow the 5 R's. Yeah, we will check that later. Well done. Well done for your answers. Okay, so to verify that we are actually giving the medication to the correct person, so you said you check the identity by checking the patient's name, date of birth, MRN, verbally and against the wristband and documentation. Well done. Okay, so that's your number 4. So during the exams, the patient, so if you are doing or you're administering the medication in hospital, you will see an ID band. Okay, again, if you're in the hospital, you will see an ID band. In the community, so what are those settings for the community? Of course, number 1, patient's residence. At home, we don't normally wear ID bands at home. Yeah? Do you agree with me? I don't wear an ID band. Yeah? So, what else? Probably if the patient is in a residential home, what else? In a care home. In care homes, residents there, they don't also wear ID bands, okay? They have a different way of identifying the patient there. What else? Let's say in a hotel, if your patient is in accommodation, yeah, a hotel or hostel, of course, we don't expect them to wear ID bands. So the only scenario in the exams wherein you will see an ID band is if they're in the hospital, okay? In any wards in the hospital, okay? So expect. I saw someone answered, you have to counter check it with your document. Okay, so during your implementation station, you will be given a drug chart. Okay, and on the drug chart, you will see the patient's essential information, such as the name, the date of birth, what else? The MRN, Let me just quickly ask you guys, what does MRN stands for? What does MRN stands for? If you know it, okay? What does the abbreviation MRN stands for? If you know it. Medical record number. Well done, Marian. Okay, so medical record number. So MRN. Well done. So wherever you go, your MRN will not. There you go. I mean, not. It's the other way around. So your NHS number will not change wherever you go. Your MRN is specific to, let's say, a hospital. Yeah. So it's from Marian. Okay, medical record number. Okay, well done, Rinchu, and the rest of you. So well done. So that's your medical record number. Okay, or the NHS number during the exams. Yeah, whichever is available. What else? We also need to check. Some of you mentioned the address. Probably, if you're in the community scenario, you might need to check the patient's address. Okay, so well done. And allergy. Well done. Allergy. So just remember this, guys, yeah, on the exam, if in case the patient is allergic to a medication, always remember that it might appear here on the drug chart. Okay, so if you want another session about the common drugs in the OSCE, if you want to continue our session last week, just put it on the comment. When we do another poll, you tell me, yeah, what session you want to discuss. Okay, so go back to that video and hopefully you will enjoy that session as much as I did. All right, so allergy. So allergies, what are the possible allergies? Probably to foods, like drugs, latex, etc. Okay, so those are the allergies. And of course, ask the reaction. Okay, what's the associated reaction to the allergy? Okay. Well done. I can still see people answering. You're a bit delayed. Okay. All right. Is it because of the time zone? Yeah, so some of you are delayed answering the question. But yeah, thank you for answering, yeah. Thank you for keeping our live interesting. How many people are watching now? All right. Next station. Okay. Oh, there are 30 million. Okay. There are 3 million watching tonight. So thank you for joining us this evening. So if you're new to the channel, welcome. Please do subscribe. We normally do this every Wednesday. Okay. All right. Next, number 5. Let's go to number 5. So before administering any prescription or the drug, including oxygen. Yeah, we all learned that oxygen is also a medication. It needs to be prescribed. Looks at the person's prescription chart and correctly verbalizes all the following checks. Of course, number 5 and number 6. Number 6, let me just read. Number 5, continue. Of course, check the identity. Read the prescription, make sure it's correct. The dose, the drug, the date and time of administration, it's present. The route, of course, and diluent if appropriate. For number 6, you have to correctly check all the following: the validity of the prescription, the prescription is legible, and of course, if anything missing, unclear or illegible, the nurse should not proceed with the administration and should consult the prescriber. So you have to escalate if anything missing. Okay? So for number 6, if anything missing here, make sure not to give the medication. If you have doubts in terms of the medication, if you're unsure what the medication, that there's something wrong with the prescription, of course, do not give it. Of course, this is also applicable in real life, not just in the OSCE. Of course, in real life, if you're unsure, you need to ask. Yeah. All right. I forgot something. So for the allergy, all right. Oh, I saw Jafalgar. Thank you for the feedback. So he said, Emer, thank you. Good evening. Sorry, I'm not reading it. I just did my mock this afternoon and I did well. Oh, that's good to hear, Trafalgar. Okay, so really, I'm really hoping that it will translate on the day. Yeah, we will wish you all the best. And that's again for those people who will be taking the exams tomorrow or in the coming days. Good luck. Yeah, we are all rooting for you. So number 5 and number 6, to summarize it, it's just basically you reading the prescription. Okay, it's number 5 and number 6. It's basically you interpreting the medication and reading the actual drug chart. Okay, I know some of you were told you have to state the 5 rights or the 10 rights. How many rights do we have? Yeah, I know some of you were told, or during your training you were trained to discuss or recite, okay, all the medication right. That is fine. Yeah, if you're not doing it, that is also fine, because when you're reading the actual drug chart, it's you demonstrating that you're following the medication right. Again, if you want to because I know I learned during during our final coaching, of course we do share some experiences there. Some people, they were told during practice to state the 5 rights or how many rights do we have before you start. That is definitely fine. And then some people, they don't do that, and that is fine as well. Okay, I've never heard someone who failed because of not stating the 5 rights before they start. Yeah, it doesn't really matter, because the most important thing is the actual reading of the drug chart, the way you interpret the drug chart, the way you read it. That's the most important thing. I hope that is useful. Okay, um, there you go. Number 7. Let me know. Yeah, let me know in the comment section if you have any questions. But let's continue. Number 7. Can you see it on the screen? So number 7 briefly acknowledges any possible contraindication and relevant medical information prior to administration. Prompt permitted. So remember, for number 7, this may not be relevant in all scenarios. So number 7, what are we thinking here? Briefly acknowledges any possible contraindication and relevant medical information prior to administration. What do you think number 7 means? Can you give me an example? So whilst you're typing, let's just play some music. Right? So the question is, what do we think for number 7? Can you give me an example? What do you think number 7 is referring to? Put your thoughts in the comment section. Yeah, give me some your ideas. What do you think number 7 is referring to? We have 3 million watchers this evening. I think this is the most so far. Yeah, so spread the news. Ask your friends to join us every Wednesday. I can see a comment from PC. He said, for example, furosemide for patients with hypokalemia. That's good thinking. What others think? Well done. That's very good thinking, PC. Yeah. Give me other example. What do you think? No other examples? Yeah. Are you running out of ideas? Are you all tired? Okay. All right. Another example from Kat: hypertension, medication for blood pressure. I don't know what you mean, Kat. If you can explain your answer further. Sakura, if the patient is nauseous. Yinka, are you asking me a question? If the finished day says ongoing, but the duration column is left empty and we allowed to administer such medication, what do you mean, Yinka? Sorry, I'm a bit confused with your question. So you're saying that the finish date is ongoing, the duration is empty. Oh, Yinka, sorry. Yinka, sorry, I mean, you can still give it because again, the finish date is ongoing, yeah? So there's no set time for the medication to end. So it's ongoing, yeah? So we don't know when it will end. That should be fine. So let's go back to the question. Kat said beta blockers for blood pressure and heart rate. Okay, so Angelica said, if you can type your examples on the chat box. Angelica said, allergy if the patient was prescribed for an antihypertensive and the BP is low. Well done. Neelam said, before administering medication, ask the blood pressure, heart rate, and hypoglycemia. Well done. I love your answers, okay? All of you are still awake. So, for those people who are probably tired typing their answers, hopefully you're thinking, yeah? So, number 7, I believe you're thinking. You just don't have the energy to type, yeah? So, thank you. Thank you for your answers. So, briefly acknowledges any possible contraindication and relevant medical information prior to administration. So, your answers are correct. So, probably, let's say, example was given furosemide. Probably before giving the furosemide, you have to check the patient's you have to check the patient's blood pressure. Okay. So remember this: the blood pressure that was taken during assessment is no longer relevant. Okay, because the scenario during the assessment station happened in the past. Okay, so probably it happened in the morning, and now you're doing the lunchtime medication. So definitely during that period, the blood pressure changed. Okay, so we don't know what the changes was. So how will you do it in the during the exam? Will you actually, so how will you do it? Will you check the blood pressure yourself, or you will ask someone? Okay, how will we know the current blood pressure of the patient? What will you do? Will you call a friend? Will you do it yourself? You check, you grab the machine. Or you ask someone. How will you know the patient's blood sugar? Well done. So thank you for your answers. So this said, ask the assessor. Okay, so during implementation station, you will not do any vital signs taking anymore. Okay, so you have to ask the assessor. So assessor, before administering this medication, may I know the patient's current blood pressure. Okay, so if blood pressure is required, because it's you demonstrating that you know what the medication is for. So going back to number 7, you know the relevant, the possible contraindication and the medical information prior to the administration of the medication. Well done. Ask the lovely assessor. That's a nice description. CC North. Okay, I hope saying your name properly. Well done. Okay. Another example is, of course, for medications to lower down the blood sugar, you have to ask the assessor again what the current blood sugar is. Question: what's the normal blood sugar levels? That's a good question. So Elizabeth is asking, could I state that I checked the blood pressure minutes ago, but you did not check it, Luce? That's the only problem. Yeah, we cannot um, make up stories. Okay, we cannot make up stories. So you have to really ask the assessor. Okay, because going back to what I said, the story progresses. Probably you did the blood pressure 4 hours ago, okay, or in the morning, and now you're giving the evening medication. So what's my so there before we answer again? My question is, what's the normal blood sugar levels? So Love said, depends on the assessor. I have a senior whose assessor was not replying when she was asked the assessor, so she took the BP again with the Dynamap. Oh my God. Um, it depends, but normally we don't expect for someone to check the blood pressure on the implementation station, guys, because remember, the main point of implementation station is to administer the drugs. Because going back to the examples from Love, again, you'll never know. Okay, it might happen, but hopefully not. Okay, because can you imagine if you're performing blood pressure at this point, you will run out of time, because we know that when you take blood pressure, it will take a couple of minutes for the blood pressure machine to inflate. So going back to my question, what's the normal blood sugar levels? So you said 4 to 7. Do we agree? Okay, do we all agree with their answers? You said 4 to 7 millimoles per liter. Is that correct? Okay, so my challenge for everybody. So where do we find the answer? Okay, well done. So in the UK, for blood sugar, for glucose, we don't use milligram per deciliter. So I mean, some of you, like, or most of you, you've used American textbooks. Let's say in the Philippines, we use milligram per deciliter. We use American textbooks as reference. I don't know how it's like for other people here. We learned during university that the normal blood sugar level is, let's say, 70 to 110 milligram per deciliter, or 80 to 120 milligram per deciliter. So in the UK, we use millimole per liter. So they said 4 to 7. Okay, so to verify if this is the correct answer, I'll ask you to go to the nice to the nice to the nice guideline website. Yeah, so you will see there that there are actually two normal range for blood sugar levels. So one for patient without diabetes, and another range for people with diabetes. Okay, so after we finish our call, not call, our live stream, go to the nice website. You will find it there. Okay, so then comment it on the video. So let's see. There are two ranges. One for people without diabetes, and another range for people with type 2, type 1 diabetes. Okay, tell me, okay, in the comment section. I know in the previous video, some of you are commenting. So well done. Thank you for answering the question. Okay, so that's our assignment. Okay, I always give assignment. All right, so again, go to the website so you can see it yourself. Okay, all right. Next, let's go next. So that's number 7. I hope you're enjoying our live session, yeah? So this is just informal. We're just chatting so we can learn from each other. Number 8 provides a correct explanation of what each drug being administered is for to the person in their care. So prompt is permitted. So in case you forget to tell the patient what the medication is for, the assessor might prompt you, okay? So they might tell you, or they might prompt you to say what the medication is for, or the actor. Okay, so for implementation station, you will be given 15 minutes and you will be seeing an actor. Okay, is it the same actor during assessment station? Most likely. Okay, most of the time, whoever you met during assessment station, you will meet them again during this station. Okay, so that's the arrangement. And in some cases, if of course they couldn't find any actor on the day of your exam, you might be talking to a mannequin. Okay, old times mannequin, but since they introduced the new OSCE, there is like an actor during implementation station. So so definitely you have to explain what the medication is for. Okay, you don't have to give an elaborate explanation. Just simply give what the medication is for. I say, paracetamol, this is for your pain. Simple as that. Okay, you don't have to complicate it. You don't have to explain that this is this and that. Yeah. Okay. Let's say. So Kat is asking, Yes, that's correct, Pat. So you will be dealing with an actor, okay? So most test centers during implementation station, you will be talking to an actor, okay? The same actor you met during assessment station, okay? They will transform and you will meet them again during implementation station. Just in case on the day of the examination, the actor was not present or they couldn't find anyone who could act, which is unlikely, you might be talking to a mannequin or a dummy, okay? There is also a chance because I heard from some people during their exams, there was no actor during this station, but most likely there is, okay? And of course, they have definitely different experiences, but thank you for sharing your experiences with me. That's very valuable. Um, what am I discussing? So that's the actors. Of course, you have to demonstrate. So let's have a quick one, okay? So let me tell you one medication, and then you tell me what the medication is for. Okay. How about I'm trying to think. Um, what is this medication for, and what will you tell the patient? Let's see. I'm trying to think. How about docusate sodium? So what is this medication for? Docusate sodium. How will you tell the patient, or what will you tell the patient? Okay, while waiting for your answer, let me just check some comments here. So I can see some answers. So Elizabeth and PC said it's for constipation. Well done. Okay, so well done. So docusate sodium is for constipation. So you might see this. You'll never know on the exam. So hopefully you learn something tonight. Elizabeth, it helps to loosen your stool. Well done. So that's the docusate sodium. So you don't have to explain like to give a complicated explanation what the medication is for. Okay, just simply say it's a laxative. Well done. And of course, it is important for number 8. We're nearly done with the marking criteria. You also need to explain to the patient or give an instruction rather whether the medication should be taken with meals or after food or with an empty stomach. Can you please, let me just ask you guys, what are the medications, group of medications that should be taken with meals or should be taken after food, yeah? So what are the group of medications that should be taken with full stomach? Let's try and recap our knowledge about medications. Okay, what are the group of medication that should be taken with the full stomach or after meals? Okay, hopefully you can answer. Let's see. Well done, PC. Antibiotics. Well done. Okay. So generally, we take antibiotics with something with meals or after meals. Okay. Apart from antibiotics, what else? Love said your NSAIDs. Well done. Can you give me an example of NSAIDs, Love? Well done, well done. Thank you for answers. NSAIDs, well done. Can you give examples of NSAIDs? Well done. Aspirin. Well done. You're classic. You're missing something. A classic medication when we think of NSAID. Ibuprofen. Well done. There you go. So if you watched the video last week, if you joined us during the live, we've discussed ibuprofen last time. Yeah. So well done. So it's ibuprofen. But of course, check your evidence-based practice. Something was mentioned about ibuprofen on your evidence-based practice. Well done. Thank you for your answer. Thank you for sharing your answer. So those are the medications. So my assignment for everybody who's watching this, if you could put in the comment section, what are the other groups of medication that should be taken with meals or generally with meals? Okay, of course there are plenty, because again this will help you during the exams. Yeah, and of course try to think what are the group of medication that should be taken without meals. Okay, so okay, what are the medications that should be taken with meals and what are the medications that should be taken without meals or with an empty stomach? Okay, so if you can comment that on the comment section, well done. Of course, I mean, during the examination, um, it might not be relevant for all medications. Again, you don't have to discuss if this medication should be taken with meals. Okay, just certain medication that you really have to tell the patient that this should be taken with meals. Okay, it may not be applicable. Remember, on number 8, on the criteria number 8 says here that this may not be relevant in all scenarios. Always remember that, okay? Because probably I made you panic. Oh, Emer, my exam is tomorrow. I didn't know that you have to explain whether this medication. Sorry, the music is too loud. And then you might panic saying, I mean, Emer, I didn't know that you have to explain or check whether the medication should be taken with or without meals. Again, it's not applicable for all medications or for all scenarios. Again, just for specific medications only, okay? Based on the marking criteria and relevant scenarios only, okay? So probably, if you have time, do this assignment, okay? Do this exercise and tell me on the comment section below what are the group of medication that should be taken with meals and what are the medication that should be taken without meals. Okay, so that's your assignment. All right, number 9. Let's probably discuss this longer. Right, we'll end at 9:30. Okay, so thank you for staying with me tonight. I hope you are enjoying the session. Number 9. So this is the hot topic, not the hot topic, that the most probably the frequently asked question in the exams. Yeah, administer I'm not lying, I'm lying, it's not number 9, number 10. Okay, before we go to number 10, so number 9 is administer drugs due for administration correctly and safely. Of course, definitely you have to administer the drugs correctly and safely. So do I need to discuss that? So definitely you have to observe the rights, the rights of medication administration, definitely, etc. And number 10, you have to omit the drugs not to be administered and provide the verbal rationale for non-administration. Okay, so probably we'll spend some time in here. Okay, let me show you the drug chart. Okay, so if you go to the website of your test center's website, you will find the supporting documents. Okay. All right. Let's show it on the screen. There you go. I'm using a different software today, so hopefully you're enjoying the setup. Okay. All right. So, all right. Let me just check it. Okay. So, are you familiar with the one on the screen? Where's the screen? This one. This one. Yeah. Have you seen this document before? Have you all seen this document before? Okay, so this document contains the supporting documents for your examinations. Okay, so I can see you're still commenting. Thank you. So this document contains all the tools, the forms, not all, but most most of the documents that you will see on the exam. Sorry, I'm blanking because I'm reading on your comments. Yeah, it's kind of fast, so I cannot see it. Yes, you've seen it, PC. Thank you. So this contains the documents, the tools that you will be using, that you will see, that you might see on the examination. Not everything is applicable for your exam, yeah? Because of course, some of this might be applicable for for adult nurses, for midwives, for nursing associates, for learning disability, for mental health. Okay, so make sure to know which one is applicable for your exams. Okay, so this one, this one, sorry, I'm struggling pointing. This is the drug chart. The one on your screen is an example of a drug chart in the community, okay? In the community. So, just so you're aware, on the exam, there will be two different drug charts. One drug chart is a community drug chart, a simpler version of the in-hospital, okay? The one on your screen. So, please make sure to download this document and practice in reading this drug chart, yeah? This one is simpler compared to the in-hospital drug chart, okay? So as you can see here, there you go. And normally, the instruction and the indication for the drug is written. Again, if you're dealing with, if you're seeing if you're getting the community scenario on the drug chart, you will see the indication of the medication, okay? So at least it's less worry. But of course, you have the BNF on the day of the exam. You have the iPad. All right, next. The next drug chart is the in-hospital. This one, what you're seeing on the screen is the in-hospital drug chart. Okay, so make sure to take your time. Spend some time analyzing the drug chart. You have to practice. Okay, there's one video on my channel wherein the guys, our old students, they are reading this. Okay, and not this, the old one, not this one, because when we filmed that, it's the old exams. Yeah, it's the old exams. But the steps will be the same. Okay, so going back to number 10, we will discuss the omission codes. Okay. Where is the omission codes? I'm trying to find it. All right. All right, there you go. The one on your screen, let's make it bigger so you can see this. These are the famous omission codes. Okay. All right. So let's have a discussion about this. Okay. So, you will be using the omission code if you are not giving the due medication. Again, you will be using, or you will be writing the omission code if you are not administering, or you decided not to give the due medication. Again, the PRN medications are excluded. Again, the PRN medications are excluded because PRN, we only give it if it's needed. Of course, you will not omit it, or you will not give it if it's not required. Okay, I hope I made it clear. Again, omission codes, of course, you will not use it for PRNs because PRN, you give it if it's required. Okay, you will only use the omission codes for due medications. Okay, medications which are required to be given now. Okay, are we all clear? Maricor is still answering my old question. Constipation, well done. So for omission code number 1, let me ask you guys. It says here, the medicine unavailable. Inform the doctor or the pharmacist. Can you please give me an example wherein you might be using this code? Okay? Can you please give me an example wherein you will be using code number 1? That's a good question, PC. So PC is asking. So I hope you can type your answers, yeah? Can you think of a scenario where in number 1, you will be using number 1? Okay, so PC is asking, even if the PRN medication is required by the patient, but the prescription is not valid, it's unlikely on the exam. PC, it's unlikely. Okay, it's unlikely. Of course, it's a different conversation if we are in real life. Okay. Of course, in real life, it's a different thing. But for the examination, it's unlikely that you will see a wrong prescription for PRN. But of course, that's good thinking. Why not? Okay? Why not? That's good thinking, definitely. Can you please, so going back to my question, can you please give me an example wherein you will be using code number 1? I hope you're typing your answers, yeah? Okay, so Kat is asking. Okay, so Kat is asking during the implementation. So implementation station, I don't know if you know this, you are only giving oral medication. Okay, for implementation station, you will only give oral medication. You might see IM subcut prescribed or inhalers, but probably not required or not due. Or probably it was given already by a colleague. Okay? Alright, let's discuss number 1. Okay, so for code number 1, I cannot see any answers. So number 1, let's say, of course, is self-explanatory for number 1. If the medication is not available, probably on your drug chart, definitely you cannot give the medication. Yeah, if let's say when you read the prescription said it's due now, and then when you go to the drug trolley rather, you cannot find the medication. Definitely you will be using code number 1. Medicine is not available, out of stock. There you go, love. That's the answer I'm looking for. Or a shortage. Another example, okay? Another example. So hopefully you'll remember this. Another example for number 1, let's say, what if the due medication, let's say for iron supplement. So what if the ferrous sulfate that you're meant to administer is 210, and when you check the stock on your drug trolley, you only have 200. Okay, of course you cannot cut the medication. Yeah, so let's say that's an example. Let's say the due medication dose is, let's say, 210, and then the stock that you have is 200. Of course, it's impossible for you to take the 10 milligrams from another medication. Yeah, unless of course the medication is intended to be cut. Let's say example is, remember there are medications wherein you can cut in half. Okay, so of course 210, and then you're missing 10. Probably it might be impossible for you to get the 10 from another medication. Yeah? So number 1 is definitely it's underdose. There you go. PC said. So that is impossible. You cannot give the medication. Although you have the ferrous sulfate, but you don't have the correct dose. That's one of the example. Okay, another one is, of course, if the medication is entirely not there, okay, not available. So you need to inform the doctor and the pharmacist, because they might find an alternative. Okay, or of course inform the pharmacist so they could request for a new stock. Okay, so that's your number 1 example. Hopefully that's useful. Number 2, patient of the ward. Okay, patient of the ward. Can you please give me an example wherein the patient might be off the ward? Okay? Can you please give me an example wherein the patient might be off the ward? Any examples? Can you please give me an example? So PC said the patient might went to theaters. Well done. Okay. Another example. So probably the patient went for a diagnostic procedure. The patient, there you go, ongoing procedure such as MRI. Well done. So any diagnostic procedure. The patient might, went to MRI, to X-ray. Patient went to the clinic. There is an appointment. Okay. Well done. So those are the examples. Well done. Patient off the ward. Of course, it will be impossible for you to give the medication if the patient is off the ward. Okay. All right. Number 2. Okay. That's your number 2. Thank you. Number 3. Okay. Can you give me an example for number 3? It says here number 3, self-administration. Okay. Can you please give me an example wherein you will code, oops, I will no longer give this medication because number 3. Thanks, Nilam. Nilam said home, leave, well done. X-ray, transfer to another trust for some reason, well done. So that's important to hand over. Okay. So for number 3, okay, what might be can you give me a scenario or a reason that you will be using number 3? Let's say, I'm not going to give this medication because number 3. What medications can you think of? Okay, while waiting for your answers, please, I just want to promote, while waiting for your answers, please, while waiting for your answers, sorry, let me just promote something. Okay, so while waiting for your answers, please do register to our final coaching. It will be this weekend, yeah? So on the chat box, you will see the link there. Okay, so hopefully you will register and I will see you there. We will discuss this further. All right. So what are your answers? Let's have a read. Let's have a read on your answers. Okay, you said inhalers, okay? Patient's own medications. Maintenance medication. Patient has already taken the medication or the nebulizer. Well done. So, of course, let's say there are instances, of course, we cannot, it's avoidable, but sometimes, of course, the patient, they form a habit, okay? An example of which is to say, the one you answered, yeah, inhalers. The patient might tell you, Emer, I've done it, okay? So they say, Emer, you're due for like a 12 o'clock medication nebulizer. Just an example, and the patient inform you, oh nurse, I've done it, okay? Because I know when to take it, isn't it? So sometimes patient, if they form a routine, an example, let's say if patient with asthma, yeah, they normally bring their inhalers with them every time because it's their safety blanket. Or sometimes some people, they might panic if they realize, oh, I didn't bring my inhaler. They might panic. Okay, so normally if you're asthmatic, you normally bring your inhaler with you everywhere you go because again, you'll never know when the attack might happen. So some of them might take it. Okay. Another example is say you're in the community. Okay. Another example, you're in the community. So patients taking insulin. Okay. Patients taking insulin. Probably they know how to administer insulin themselves. So by the time you visit, when you're about to give the medication, as an example, the patient's told you, oh, Emer, I've done it. It's done. I've administered it. I know how to do it. So probably that's the time. Of course, you have to check that they've given the correct medication and the dose, etc. But most of the time, if they are diabetic, they're in the community. Of course, before they leave the hospital, if they're independent and they could do it themselves, we normally teach them how to do it themselves. Yeah, to promote independence, of course. If they're capable, yeah, if they're capable to do it on their own. That might be number 3. Okay, so that might be number 3. So thank you for your answers. All right, let's continue. Just an example. All right, let's continue before we end the night. We're nearly there. All right. So number 4. Can you please give me an instance we're in? Number 4 is the omission code. Unable to administer Inform the doctor. Alternative route required. Can you please give me an example wherein we are using code number 4? Hope you're still awake. Any guesses? I hope you're not sleeping yet, yeah? All right. Okay. Any guesses for number 4? Well done, Elizabeth. Okay, so for number 4, unable to administer, one possible reason, one of the possible reasons, it's difficulty of swallowing, or we call it dysphagia. Patient can't swallow, well done. Or probably the patient is feeling sick. Okay, the patient is feeling sick. The patient is nauseated. Okay, wherein when you give the medication, they will vomit. Okay, they will puke the medication. So, of course, it will be challenging. It will be difficult for us to give the medication. So that's why it's number 4. So inform the doctor, unable to give, alternative routes. So probably think of other routes such as IM, subcut, IV, sublingual, if possible. Yeah, if possible. So those are your other reasons. John, thank you. I'm unable to swallow. So that's for number 6. Of course, number 7, patient refuse. What else can we do? Yeah. Of course, going back, remember at the beginning of our session, it is important to explain the reason why you're giving the medication. If they refuse, of course, you have to, explain further, give the full picture. What's the reason behind you administering the medication? And code number 7. Okay, code number 7. Number 8. So number 8, of course, it's nil by mouth. This one is also easy. I don't need to explain this. Of course, if the patient is nil by mouth. Can you give me an example wherein the patient will be nil by mouth? Okay. Can you give me an example wherein the patient will be placed in this situation? Okay. Can you give me an example wherein the patient, you will not give the medication because the patient is nil by mouth? Can you give me an example of a scenario or an instance? Well done. Love and peace said for pre-op. Okay, for pre-operative procedures, for OR, for so normally here in the UK we use the term for theaters, yeah. Instead of saying pre-op or OR, we call it here for theaters. Okay, so it means the patient is going for a surgery. What else? What else? Apart from going to the theaters, what else? Any other reasons that your patient might be placed under nil by mouth? For theaters, well done. Most of the answers, okay? So try to think. What other reasons? I'll give one example. So what if the patient experiencing difficulty of breathing, yeah? Rapid respiration, wherein if you give something by mouth, they might aspirate, okay? Another example. But try to think, what are the other examples? Apart from surgery, apart from the patient going to surgery or to theaters, what are the other reasons that the patient might be nil by mouth? Okay, so thank you for all your answers. You're still awake. Blood extraction, that's very good. Love, I love your answers, yeah? Your answer. So Love said, of course, definitely, if the patient is for a blood test and nil by mouth is required, that's good thinking, okay? So, well done. Next. Number 9, low blood pressure, of course. Can you give me examples of medication wherein it will cause number 9? Okay, can you give me examples of medication wherein it will cause number 9? Think of the medication, list it on the comment section that will cause number 9. That's a good answer, TC. The upper GI bleed, okay? Furosemide, of course, our classic example. What else? Can you give me other medication that would cause the patient's pulse to drop and or the blood pressure to drop? Ramipril, Nilam, well done. That's a good answer, Francisca, to my previous question. Well done. Of course, if you're fasting blood sugar, you might need to fast for certain hours. Okay, what are the other medication? Well done. So if you have furosemide, you have your ramipril. What else? What other medication that could decrease the patient's heart rate and blood pressure? Digoxin. That's it. Well done. What else? Of course, digoxin could lead to bradycardia. Okay, definitely you have to check the patient's heart rate prior to giving this. So, similar with, going back to the previous conversation, of course, you have to check with the assessor what the current vital signs or observations before giving a certain medication. You don't need to ask everything, okay? Normally, they will just tell you it's within the normal range, okay? That's the normal answer that you will hear from the assessor. They don't normally give exact numbers, but they will just tell you it's within the normal range, okay? Just make sure you know the normal range, just in case. Amlodipine, atenolol, yeah. Of course, you have loads of antihypertensive medication. So you have your beta blockers, your calcium channel blockers, you have your ACE inhibitors, you have your, what else did I miss? Your beta blockers, there you go. My mind is no longer functioning. Help me, put it on the chat box, yeah? Well done. So, and number 10, others. Okay. Guys, before we end the night, can you please tell me what others? What are the other reasons that you might omit the medication? Okay? Bisoprolol, of course, Irish, well done. Okay. So, what are the reasons that we might be using number 10? Okay. What are the reasons do you think we will be using number 10? Okay. I know it's others, but can you give me an example wherein we will be using number 10? Love said allergies, number 10. Do you agree with Love? Any other thoughts? Thank you for the 3 million subscribers who's watching us tonight. So please do subscribe. Follow me on my social media. It's here on the screen. Allergy. Apart from allergy, what are the other reasons? What are the possible reasons you will be using others? Love said patient already ate. Meds were supposed to be taken before meals. I don't know if I understood your answer, Love. You're referring to medication that should be given. The patient ate and then you aren't omitting it because it's meant to be given without meals. What do we think about that? Okay. All right. Of course, definitely, Marian, yeah. Of course, the patient is dead. Do not attempt to give the medication, yeah. All right, definitely, Marian. If the patient is already dead, you can no longer give the medication. Definitely number 10. So I'll give you an example. So your answer is correct. Definitely, not, the allergy could be a possible answer. Okay, but let me ask you guys, yeah. There is a code for allergy. Number 10 is for definitely you can use number 10 to code allergy. But there is a code that is best to use if the patient is allergic to something. It's on the screen, yeah? Have a look. Is it 1, 2, 3, 4. I know you've watched my old video, but that's an old one. That's why we're doing this again. So 1, 2, 3, 4, 5, 6, 7, 8, 9. From 1 to 9, what is the best code for allergy? So Love said 6. No, not Love. It's not you. It's who said 6? PC said 6. Okay. Who agrees with PC? What others think? Irish says number 6 as well. How about others? What do we feel? For the 3 million people watching us tonight, what do we think? 6. Well done. Okay. So, guys, remember this. If the patient is allergic to something, the best code to use is number 6, not number 10. Okay? Although number 10 is also correct because others, remember others, you can use it whatever you like because it's others. Okay? So, you can replace others infinitely, whatever reason that is. Of course, unless it's not included on the codes, yeah? But the best answer is definitely number 6, okay? Because number 6, what does number 6 states? Number 6, I obviously missed this earlier. Prescription is incorrect / unclear, okay? If you think about it, let's say if the prescriber wrote something on the drug chart wherein the patient is allergic to, do we consider that as an incorrect prescription? Let's say I am the prescriber. Let's say I am a nurse prescriber. Yeah, and then I prescribe this medication to Emer. Let's specify. Let's say amoxicillin. Okay, as an example. And then Emer is allergic to penicillin. Say I'm a prescriber, yeah? And then would you consider that an incorrect prescription? Of course, yeah, of course, definitely. We consider the prescription incorrect because, of course, you should not be prescribing a medication the patient is allergic to. Is that clear? Okay. There you go. Well done. Okay. Hopefully, if this is your first time learning it, well done. Thank you. Definitely. If you can sound it on the comment section, if this is your first time hearing this explanation, type, what do we type? Not amen. Put a heart, okay? Do not type amen. Don't type a heart, okay? All right. We are not forming a cult, okay? So, yeah, type a heart on the comment if you learned something new tonight. Yeah. So again, of course, definitely. If the medication is not, the patient is allergic to this medication, that's a wrong prescription. Okay, so the prescription is incorrect. Okay, so, but Emer, can we still use number 10? Of course, okay, because like I mentioned, you can replace, it says there are others. Why not? Because if you think about it, from 1 to 9, the word allergy was actually not mentioned. Okay, so there you go. PC, thank you for the heart. Okay, no one gives me heart nowadays. So, so thank you for all your comments. Okay, I hope you enjoyed that. So 6 or number 10. Okay, 6 or number 10. But if you ask me, I'll go for number 6 because it's more specific. Okay, its prescription is incorrect. All right. One more before we end the night, and one more code. For once only code, do we code it if you cannot give it? If you're omitting it, definitely PCI. If you are not giving it for some reason, there should be a reason why you're giving it. Okay, so you can choose from the codes. Of course, I forget this number 5. Okay, a lot of people failed because of number 5. Okay, stat dose given. So let's say an example again, just an example. Let's say furosemide. The patient. I'll give an example. Patient is receiving furosemide once daily. Okay. And then, when you saw the prescription, there is a furosemide. It was given on the stat dose, yeah? An hour ago or 2 hours ago. It was given on the stat. And then, when you go to the regular medication, you saw another furosemide that's meant to be given once daily. So let's say at 12 noon, because your due meds now, you're meant to give the 12 o'clock medication. So of course, you will not be giving the medication again because number 5. stat dose given. Okay, remember that. Again, example, of course, there are medications wherein you can give multiple times in a day, definitely. But just an example, okay, just so you remembered it. Let's say a medication that is meant to be given once a day only, and it was given earlier as a stat dose, and you saw it again on regular medication prescribed. It could be on the same time, okay, or let's say 2 hours after the stat dose was given. Definitely you have to use the omission code. Number 5, stat dose given. Of course, you don't want the patient to suffer from drug overdose, okay? Just an example. All right. Um, those are the codes for tonight. So I hope you enjoyed it. Any questions? I know I can see a lot of questions on the chat box. Unfortunately, we don't have any time left. Okay, so let's just close our conversation for implementation station. Yeah, the remaining criteria. Before we say goodnight, I hope you enjoyed it. Yeah, please let me know in the comment section if you enjoyed our chat this evening. All right, there you go. Where is it? All right, let's go back to the marking criteria. So before we end the night, let's just finish this. Okay. So we are done with number 10. Number 11. Where is it? Oh, we are now on the clinical skills. Okay, there you go. Thank you for the people who stayed tonight. I know you're very tired. I don't know if someone from the Middle East this evening or from their home countries. I remember last Wednesday we had people from the Middle East, from KSA in particular. So shout out to those people who's watching from home or in the Philippines, if in the Philippines, or if you're from India or from Nigeria, from Ghana. Those are my usual students, yeah? Just let me know in the comment section if you're from a different country, yeah? I haven't mentioned yet. Thank you for joining us. So, let's finish it. Thank you. Next, number 11, of course, you have to accurately document the drug administration and non-drug administration. Always remember this, guys. If you're giving it, of course, you have to sign it, yeah? It's essential you have to put your signature, of course, definitely. Your initials. And, of course, if you're not giving the medication, you have to put the omission code. Again, do not just leave it blank, especially especially for example, is stat and regular medication, because if you leave it blank, if I am your colleague, if I am doing the drug rounds, I might interpret it as, number 1, you forgot to give the medication, or you never attempted giving the medication. So what will I do? I might give it, okay? Or I might ask the doctor, someone or colleague to, what happened? I might need to investigate it, of course. Definitely, if it's blank, that means it was never given. Remember, if it's not documented, it didn't happen. So definitely, if you did not give the medication, you have to put the omission code, and of course, you have to sign it. Put the necessary information on the box. Because again, it might be misinterpreted by someone. So number 12, you have to accurately document the details of the person administering the medication on page number 2. So on your drug chart, on the second page, there is a space intended for you to sign. Again, on the drug chart, on the second page, there is a section wherein you have to put your signature. You have to put your name, your base ward, and of course your signature. Okay, so it's on the second page. Okay, if you haven't seen it, sorry, we don't have time. Just go to grab a drug chart and then have a look. And of course, last but not the least, make sure to act professionally at all times. Yeah, do not argue with the assessor on the day. Yeah, okay. Do not argue with the assessor. Of course, you need to be professional at all times, because again, we are all registered. Of course, you are registered professional in your home country, and soon here in the UK as well. Okay, so before we end, yeah, do you have any other questions? Sorry, we don't have enough time. We have to end the night, unfortunately, because if not, I will be talking until 1 o'clock in the morning. Okay, all right. So, yeah, any questions? Put it in the comment section. Yeah. Again, to advertise, we have a final coaching this weekend. Hopefully, you can join. We will discuss this in more depth. For those people, I know some people who attended the final coaching. Hope you enjoyed it. Yeah. Comment on the comment section if you enjoyed it. Hopefully, yes, because they will not enroll. Yeah. All right. So I cannot see any questions. So shall we end the night? No questions? Yeah. So sending big heart. Yeah. Thank you, PC. Okay. So I cannot see any questions. So please subscribe on my channel. More than 60% are not subscribed. And of course, follow me on my social media and see you on next Wednesday. For those people who I might not see again because you passed the exam tomorrow and in the coming days, of course, congratulations. For those people who will be taking the examinations in the coming days, good luck, yeah? Good luck. Let us know if you pass. Go back this video and then comment below if you passed the examination, if you find something here useful. Okay? Thank you again, and I hope to see you on the next one. Okay? Good night, everyone. Good night, good night, good night, good night. Bye-bye.